Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a March 25th, 2021 update from the Dubuque County Public Health Incident Management Team. Newsflash, Dubuque County's COVID-19 new case trend line is trending upward, with 87 cases reported in the last 7 days. That's increased from the 51 cases I reported on the previous 7 days on Monday. Today, 26 new cases were reported. That's the largest 24-hour increase since February 25th. Is this the beginning of the post-spring break or post-St. Patrick's Day surge? I hope not. And remember, only 13% of the population has immunity due to having COVID-19 infection or disease. 19% have been fully vaccinated. We can't add those two numbers together for our herd immunity because many people who have been infected have now been fully vaccinated. Plus, we don't know how long natural immunity lasts, that from having the disease. But it's a pretty good estimation that about 20 to 30% of our county population has some immunity to COVID-19. That's not even 1/3 of our population. Community immunity, or herd immunity, requires at least 60 to 80% of the population, and that number is still being debated. I mentioned Dubuque County's trend line going up. Well, the bad news is it's also increasing around the U.S. and in many parts of the world, in Asia, the Americas, and Europe, together with more counties, states, and countries experiencing increasing numbers of the COVID variants. So if you are experiencing any COVID-19 symptoms, get tested. Testing appointments are widely available through both Test Iowa sites and also through your healthcare provider. Dubuque County continues vaccinating through healthcare providers, pharmacies, and our pod, or point of distribution at the Kennedy Mall, and Mercy's pod out in Piasta. This all as our allocations slowly increase, either from the Iowa Department of Public Health or the Federal Retail Pharmacy Program. We are concentrating on work site vaccination for employees and for those 65 and older, and also for those 16 to 64 years old with underlying conditions that put them at risk for severe COVID-19 disease. And that includes overweight and obesity. So when you have the opportunity to be vaccinated, don't pass it up. And if you think you want to wait until one particular vaccine is available or a different vaccine than the one that is being offered, that would be a mistake. Because you may be infected while waiting for the next vaccine opportunity. And with the cases going up, that possibility goes up. Also, if you pass up the vaccine opportunity because you want a different brand, you may not only get infected and become ill, you may become one of the long haulers who have lingering symptoms and feel ill for months after the infection. That is not something anyone wants. Some research indicates up to 10% of those infected with COVID-19 may turn into long haulers. All currently authorized and recommended COVID-19 vaccines, including Pfizer, Moderna, and the Janssen or the Johnson & Johnson vaccine, are safe and effective. And CDC nor Public Health does not recommend any one vaccine over the other. Bottom line here, brand doesn't matter. Get the first vaccine available. Another concern that's been popping up frequently is scheduling the booster dose for your vaccine. If you're not available when you're scheduled to receive your second dose, for instance, if you're ill or exposed to COVID-19 or a variety of other reasons, or if you received your first dose somewhere else while traveling, but now you're home and don't know how to get your booster dose, you can call your healthcare provider and ask to be placed on the booster bench list. Or you can leave your information on the Sleeves Up phone line at 563-587-4950 to be put on the booster bench. Either way, a provider will notify you when they have extra booster doses available to give. This will take some patience on your part, and you may not get the vaccine exactly on your 3 or 4 week date past when you received your first dose, but that's okay. There is some flexibility in the time frame to receive your second dose. but it's important to receive that second dose. As we continue on this second year of the pandemic path, most of us now realize this is more than just a pandemic of an illness. It's a pandemic of brain health issues, of loneliness, of loss of business and income, and not to forget, loss of friends and loved ones and our fellow neighbors and community members. We have to continue to help others. We're getting vaccinated, but the road to recovery for everything else will be long and take effort for all of us. As I value friendship and togetherness, and especially an occasional hug, more than ever, I share a greeting card I received recently. Life is like riding a bike. To keep your balance, always look forward and just keep moving. So this weekend, pump up those tires and get your groove on, or get out those walking shoes or whatever it is to get you moving and thinking about moving forward in this year as we work toward recovery, all in this together. Have a great weekend, everyone.